keeping a close watch, but the rise in the cases comes at a time when the Delhi and the several other parts of the country are seeing an increase in respiratory infections during monsoons. Doctors say humid and fluctuating weather conditions can favor the spread of respiratory infections, particularly in crowded indoor spaces. Hospitals are already reporting H1N1 cases, with doctors observing an increase in infections in August compared with July. H1N1 can initially look like a common cold or viral fever, but the impact of it is tremendous. It requires a separate medical course. You need to stay away, and the test is done on the prescription of a doctor. And that is the most important aspect. And the H1N1 spread is 3 times more than the last year. And that is why the scare is. On this issue, I am joined by Dr. Manoj Goyal, pulmonologist from FMRI. Thank you so much, sir, for joining me. So why is H1N1 on rise and 3 times more than the last year, sir?
I think possibly this time we got more virulent strain because this virus keeps mutating every year. And other thing is that we are having this kind of surge after several years. So the last surge that we had was before COVID. So possibly the herd immunity is also less. Plus the atmosphere, the environment is also conducive to the viral spread. Like it's more, there is a moisture in the air, there is a humidity that favors the replication and multiplication of the virus. So there are multiple factors which may be leading to this surge of this kind this time.
And the 3 times more, do you think that these viruses can become potentially, if I may use the word, lethal? If the mutation, because last time I remember when H1N1 happened, it was I think 2009 and 10, when I got my test done on a doctor's prescription, because I also went down. So, first the treatment was of viral, then, again I was tested for dengue, and then I was tested for H1N1. So I came positive for 3 strains, and it said H1N1, and in the bracket, sir, it was written 2009.
Yes, so traditionally it's a 2009 strain, but it has mutated several times from there. So it is just now H1N1 strain, as a matter of fact. It's another influenza virus infection. Now, I don't see that it's become very lethal at this point of time. It's a very localized spread which is occurring in Delhi-NCR, so I don't think there should be a panic button that you should press. But yes, I can see the trend. I mean, about 1 week ago, there was rise in the patients, but they were less symptomatic. But now we are seeing more symptomatic patients, more severe patients who are coming to the hospital with pneumonia, with low oxygen saturation, and even landing up in the ICU. So severity has increased over the last 1 week, and the number of cases also increased. So at this point on, I think the virus is multiplying, and we have to be very careful.
Dr. Goyal, why are viruses spreading so fast in last 50, 60 years? Earlier, that was not the case historically recorded. For example, the Spanish flu. It's just, though it's an American thing, the name became Spanish, it came from the American farms. Why has it become so frequent? Why has mutation become so frequent? Is it because of the connectivity? Can you just give us a historical perspective?
I think, yes, the connectivity, as you said, is a very important point. We are mixing with the people, and it spreads from person to person contact. So the contact is more, as a matter of fact. Plus, we have been able to diagnose these infections quite early. Those facilities were not there early. And so these have been there. The viruses are quite genetically engineered, and they are much more powerful, and they mutate very, very fast. So this is something which is not very new, but yes, the crowding, overcrowding, mixing with the people, transcontinental travels. So all these things have contributed to the, spread of the viruses all over the continents and all over the world.
Why do you say, sir, the herd immunity is low? And, and please do explain it to our viewers what the herd immunity is. A lot of people will not understand that.
So herd immunity occurs because of the low viral infection, and then, people get immunized because this low viral load where they do not become symptomatically, where they may not present symptomatically with symptoms of viruses. So that is what called herd immunity is, and this happens with prior exposure to the viruses. Now, I don't see that, to confirm that the herd immunity is less or the virus become more virulent, we need to do genetic studies. But this is what we as clinicians are presuming at this point of time, because this virus has come back in such surge after several years. So possibly our exposure over the last few years has not been that great. And the other point is our vaccination rate is very low. So the best way to prevent, from the viral infection is to get vaccinated, especially the influenza virus. So we need to increase our, vaccination with influenza, and that would help in preventing this kind of spread and disease spread.
Is that the only way to avoid these viruses, yearly vaccination? And is it really okay for our body to go for a yearly vaccination? I mean to say, what's your assessment? Because vaccination in itself has its history and body of work.
This is the most important intervention, as a matter of fact, to everybody or every child more than 6 months of age till the entire, elderly population. They should all be vaccinated, especially the more vulnerable people like children between 6 months to 8 years, then elderly people, those who got chronic lung diseases, heart diseases, diabetes, hypertension, kidney diseases, immunocompromised hosts, pregnant women, they should get vaccinated on priority. But as a matter of fact, even normal individuals, healthy individuals should get vaccinated, because this is the most effective way to prevent you from getting infected with this virus infection. Besides, avoid at this point of social gatherings, overcrowding, use masks, do proper hygiene. The other way this virus spread is by touching the contaminated surfaces. So keep cleaning your surfaces which you use very frequently, like mobile phones or doorknobs. So hygiene is very, very important.
So what is this virus H1N1, and how is it different from COVID?
Yes, it is definitely different from COVID. It is an influenza A virus. It is a type of influenza virus, whereas the COVID was a different kind of virus. And is not as infectious as the COVID was. So the infectivity of the H1 virus is much less as compared to the COVID. So I think we are not reaching to that kind of a problem that the COVID that we had with COVID.
Because you mentioned the word pneumonia. COVID affected your lungs. So what does H1N1 affects, and what is the origin of H1N1?
So traditionally, we know that H1N1 originated from the pigs, but now pig is no more in the picture. There is a direct contact from person to person, as a matter of fact. But the name stays there as swine flu. Like any viral infection, pneumonia can occur. Pneumonia, lungs are the most vulnerable sites as for the viral infections, especially like, for influenza. So very serious kind of infection when it occurs, then you find the pneumonia, and these patients would have breathing difficulty, low oxygenation. Sometimes it affects your mental status, so they can become drowsy. They can go into the altered sensorium, the BP may fall. So, but this happens in only patients who have suffered a very serious kind of infection. But largely, majority of the time, patients who have mild symptoms, like they got a cough, headache, body pains, runny nose, sore throat, and then it is a self-limiting condition which goes away in 4 to 5 days time.
And most importantly, does the viral load also make a difference? Because a lot of people, they came with high viral load, less viral load. So does that also make a difference, sir?
It does make. I mean, if the virulence is high, the viral load is high, it becomes more dangerous and more infectious, as a matter of fact. But then it also depends on the immunity of the person, as a matter of fact. So the immunity of the person is immunocompromised, or those, as I mentioned, are the vulnerable groups where, it can cause more serious disease. So they have to be, prioritized for vaccination, as a matter of fact.
Okay, thank you so much, sir, because, this has caused great concern. Meetings have been held. But yes, one has to take precautions, and one also needs to understand that once you have been diagnosed, you need to ensure that you don't spread it to others. Thank you so much, sir, for joining me, and to all my viewers. This is all I had tonight. I'll see you next week. Thank you, and good night.
The National Eligibility Cum Entrance Test, NEET UG 2026, has been completely upended following a massive paper leak scandal. One of the most organized exam fraud networks this country has ever seen. Well, the world's strategic center of gravity is very quickly shifting towards the Indo-Pacific. The Quad wants to move beyond symbolism and summit optics. It wants to become far